Although twins are very exciting news to hear and can be very exciting to find out that you're going to be carrying, they certainly carry additional risks for the pregnancy. The incidence of twins overall in the United States has been increasing steadily over the last several years, but the twins that we worry the most about, identical twins, still remain about 4 per 1,000 pregnancies. Identical twins can share a placenta or they cannot share a placenta, and it's the identical twins who share a placenta, what we call monochorionic twins, that have the highest risk for the pregnant woman and for her children that she's carrying. About 2/3 of identical twins are going to share a placenta. And this monochorionic twins have a higher incidence of birth defects, about 2.5 times higher than non-identical twins or twins who don't share a placenta, but they also run the risk for something called twin-twin transfusion syndrome, and we see that in about 15% of monochorionic twins. Twin-twin transfusion syndrome occurs when these kids who are sharing a placenta don't share the blood equally, so that all monochorionic twins do share blood supply, but when there's an unequal distribution of this blood, and too much blood is going to one twin, that twin is called the recipient, and that extra blood flow to that baby can cause heart failure and other problems related to the twin-twin transfusion syndrome. For the baby who's donating the extra blood and doing that extra work of producing that extra blood, they can become smaller, have less urine output, so they have less fluid around them, and they also are at increased risk for this pregnancy. When a pregnancy develops twin-twin transfusion syndrome, the mortality rate for those kids is very high, and depending on how far along a woman is in pregnancy when it first is seen, the mortality can be anything from 60 to 100%. And the earlier in pregnancy that we see development of twin-twin transfusion, the more serious it is for the woman and her children. So in those pregnancies where the twin-twin transfusion syndrome occurs earlier in pregnancy and we see too much fluid around the recipient, so-called polyhydramnios, and too little fluid around the donor, called oligohydramnios, at earlier gestational ages, then these kids may have 100% mortality if the condition is left untreated. Fortunately, we do have some options for these women and their children. The most common options that are offered are laser ablation of the fetal vessels or amnioreduction. Depending on where in the pregnancy you're being seen and certain specific factors that we may identify on ultrasound, one or the other may be a better choice for one woman than the other. These pregnancies that have monochorionic twinning require very close surveillance for identification of the early signs of twin-twin transfusion syndrome, because it's with early identification and treatment that we can anticipate the best outcome for these women and their children. We tend to follow them with ultrasound every 2 weeks, looking for shifts in the fluid volume between the two babies for the development of the polyhydramnios and the oligohydramnios. If we start to see changes in the fluid volume or changes in the growth of these babies, then we begin recommending weekly treatment until a diagnosis and potential treatment plan can be definitively identified and outlined. Knowing that there's twin-twin transfusion syndrome, in addition to following closely with ultrasound looking for the early signs, or knowing a woman is at increased risk for twin-twin transfusion syndrome, and following her with ultrasound is a huge part of her evaluation and obstetric care, but it's also important to recognize that these women are at very increased risk of prematurity, and so we follow them closely for signs and symptoms of preterm labor, following their cervical length, and being able to intervene if there's any signs of preterm labor developing.